Dear audience, last but not least from the dentist, let me introduce my PhD topic, which is connected to novel devices in digital dentistry, which are intraoral scanning systems. Intraoral scanners are used as they are for impression taking from the oral cavity, but they are not just impression making machines, but they also have some additional features which can be used in everyday dental practice. My name is Viktória Vitai, and as a prosthodontic specialist, I really want to engage my patients. This is why my vision is a fully digital prosthetic workflow available for all my patients. How can I reach my goal? My mission is to make the prosthetic treatment cost-effective, fast, cheap, and of course predictable with the help of intraoral scanning systems. I have been working with these devices since I was a TDK student, and with the digital working group, we have already started clinical studies with these devices. One of them is a published work which is connected to the additional features of intraoral scanner systems, and it is about the shade determination tool of these devices. The second topic, which is also a clinical study, is connected to the accuracy part of these intraoral scanners. It's an ongoing validation study, and we want to see how these intraoral scanners can make our life better with this validation study. The two meta-analysis topics are connected to both of these clinical studies. So one of them is about the accuracy part, and the other one is connected to the shade determination tool. So the first meta-analysis, as I said, is the accuracy of the intraoral scans compared to reference scans in full arch cases. Dentists have a very wide range for the dental restoration materials, what we can use, and most or some of these restoration materials can only be manufactured with computer-aided design, computer-aided manufacturing techniques, as you have heard before from Anna and Peter, of course. To use these techniques, we always need a 3D file, for example, STL files, which is standard tessellation language. And intraoral scanners are the devices to get these 3D files. Unfortunately, we have many intraoral scanners on the market, and this market is always growing. So we have the problem with the accuracy part of these devices. Although they are clinically acceptable in single-tooth accuracy, but the full arch cases seem not to be defined. We have a lack of the precise and the predictable prosthetic treatment in the fully digital workflow, so that's why we really want to investigate the accuracy, the precision, and the trueness of full arch intraoral scanning with the different intraoral scanning systems. My question is that what is the accuracy of the different intraoral scanning systems when we are scanning the full arch? And our hypothesis is that there is, none of the scans made with these intraoral scanners can significantly differ from the reference STL files made with the reference scanners. So the outcome should be the accuracy, and the intervention what we are watching is the intraoral scanning systems. And the reference is always a reference scanner, and we want to compare it with the reference STL file in full arch cases, which means that we want to check the maxilla and the mandibular arch. And if we are right, then intraoral scanners can make the accurate digital virtual model of full arch for the predictable digital workflow. In my systematic search, I used the population and the intervention part for the query. I already done the second Cohen's kappa, it's about 0.9, and I got about 143 full text which is eligible, and I already started the data extraction part. My second topic is connected to the additional feature of intraoral scanning system, which is the shade determination tool. So we want to compare the shade selection with intraoral scanners to spectrophotometers. 65% of dental restorations has to be remade because the shade is not good. So that is why color is an important thing in our dental practice. We have the conventional method for shade determination. What you can see in the middle, we usually use shade tabs, which is a very subjective and it is a visual method, so we cannot rely on this one. That is why new digital methods were introduced in the market, and the first one was the spectrophotometers, and they usually use this as gold standard in dentistry. But when the intraoral scanners arrived, they show that they can also make these shade determination as an objective method, and that's why it is very important to investigate the accuracy, the reliability, and the repeatability of the shade selection tool with the intraoral scanners. So the question is, what is the accuracy of shade selection with the intraoral scanners? And our hypothesis is that there is no difference between shade selection with the intraoral scanners and with spectrophotometers. In my outcome part, I want to see the accuracy of the shade selection with intraoral scanners compared to the spectrophotometers, which are gold standard in dentistry. So if we are right and they are available for the everyday use, they can be an objective method and can be as accurate as spectrophotometers. They can give us time-effective shade selection and comprehensive case documentation for patients. Of course, you don't need another device for this method. My specific goals are to finish both of these meta-analyses until August, and of course to finish the clinical study on the validation part of intraoral scanning systems. I really want to thank you for your attention with Semmelweis reflex, which is the tendency to reject new evidence or new knowledge because it contradicts established norms, beliefs, or paradigms. Thank you very much.
Thank you. Questions, please.
How available these stuffs in standard care, for example, for standard dentists?
They are already used in everyday dental practice. We also have two types of intraoral scanners in our clinic, of course, but in Hungary they are not really common. They are used in America and in, for example, Germany a lot. So they have almost every clinicians have this. And what is it used for? So we can do like check-up impressions to check the patient's health, for example, or as prosthodontists, we usually do prosthetic treatment with the help of intraoral scanners.
Taking in context the financial part, do you know about it?
Yes, so these devices are very expensive, but there are differences between the devices, so that is important to see which are most cost-effective. But within the different intraoral scanner systems, we will find. So I will give you an example. So you can imagine that they are very similar to smartphones. For example, you have a very easy to use one, or you have a much more expensive one, which can know more additional features, for example, and these are more expensive, for example.
Okay, thank you.
I would like to ask regarding the spectrophotometers. They are one of the most objective ways to detect shades, I believe, as well. But do you find them widespread, or are there any other methods that we use nowadays to detect shades or determine shades?
Spectrophotometers are said to be gold standards in the clinical shade determination, and they are an objective method, and of course there are other methods for that, but these are most common, but also dentists don't really like to use it because it is a device just for the shape determination, and it is about 500,000 forints. So I think it's expensive for example, Hungarian dentists. But if you already want to buy an intraoral scanning system, and if the shape determination tool can work, then you don't need to buy a brand new device for that, because it is involved in the system.
Thank you. This is where I wanted to go with my question.